Welcome to the Low-Carb USA podcast, where we seek to inspire you to help us build this community. I'm Doug Reynolds.
And this is Pam Devine.
Okay, so for this podcast, we're actually going to be talking about type 1 diabetes. Of all the conditions that we know benefit from this therapeutic carbohydrate reduction intervention, type 1 diabetes seems to be the one that's still out in the wilderness, that's not taken as seriously as many of the other conditions. I know that the type 1 community is a very, very tight community, and the ones that do acknowledge this intervention work with each other to help each other, but it's very difficult for them to really function, and they can't find very many doctors that will help them. And so in our upcoming event in Boca Raton, we're going to have an entire focus day on type 1 diabetes, and in fact, an entire workshop for the afternoon before as well, with practical advice and help for patients and for practitioners in terms of utilizing this intervention for type 1. One of the people that's been instrumental in helping to get that part of the conference arranged and planned is Pascal. And I have him on with me now. And I think, Pascal, we can go and talk about the event a little bit later. But right now, I'd like to start with your story about how you found out about this as an intervention in the first place. And then maybe talk about you like off air, you were talking a bit about some of the statistics about type 1 diabetes and all of that. So maybe we can do that and highlight the problem. And then we can talk about hopefully how this event next month is going to help.
Well, hi, Doug, and thank you for having me on your podcast. So I've had that type 1 diabetes for 40 years. I was diagnosed at the age of 11. And since the beginning, my disease has been a struggle for me, my parents, and my family. After 20 years of high blood sugars and the roller coaster ride of the blood glucose, I started to develop many complications. So I had retinopathy in my both eyes that required laser therapy to limit the damage. But still, after laser therapy, the bleeding and the damage was still progressing in my eyes. I developed diabetic frozen shoulders, so I wasn't able anymore put a t-shirt. It was a struggle for me to put a t-shirt. I had trigger fingers in my hand that requested surgery. And I remember when I got the surgery, I asked the doctor, what is causing this problem in my trigger finger? And he said it's high blood glucose. So you have to control your blood glucose to limit the damage from the diabetes. So after about 30 years of living with diabetes, I woke up one morning after a very bad night where I had this very severe hypoglycemia. So I woke up and I was sick of my disease. I was overweight. My weight was around 209 pounds, around 95 kilos. So I was overweight. I was insulin resistant. And I had fear of losing my driver's license because of my retinopathy. So I looked at myself in the mirror this morning. I said, I don't know, I will do it, but the rest of my life will be the best of my life. So I decided to subscribe to a gym and start training. I started to run, and I ran my first half marathon. I ran my first marathon, but even then, trying to control my blood glucose while running was a nightmare. I remember during my marathon, my blood glucose went up to 400, and then it went down to like 60, then it went back up to 200. So it was a total nightmare. And after running my first marathon, I would have expected that my A1C would go down, but it went up from 8.5 to 9.2. So I was kind of desperate. But a few weeks later, I was listening to a marathon training podcast, and the guest was Tim Noakes. And he was talking about the type 2 diabetes reversal. And he wrote the book, The Lore of Running. And he said that he would have to tear the pages on nutrition in his book,
Yeah.
and he would have to rewrite them because he was totally wrong that an athlete wouldn't require that many carbs to perform during endurance training. So, and then he talked about this doctor from New York, Dr. Richard K. Bernstein, so a type 1 diabetic endocrinologist who reversed his complication and had normal blood glucose. Dr. Bernstein had end-stage renal disease in the early 1970s, and he totally reversed. Now he has perfect kidneys. He reversed his complication. So I bought his book, I read his book, and I was shocked. I was happy to find his book, but I was almost also shocked because no one ever told me about this way of managing type 1 diabetes. So then I read the book twice to make sure that makes sense to me. And then I started reducing my carbs without telling my doctor, but I wanted to talk to my endocrinologist. When I met her, I asked her, I want to go low carb to help with my type 1 diabetes. Then she looked at me like, this is total nonsense. And she looked at me like I was a walking time bomb in her office because I wanted to do low carb. So I showed her Dr. Bernstein's book, and she was kind and said, okay, well, I will support you. Let's try it, but I really doubt this will work. And I told her I will bring my A1C for the first time in my life below 7%. She said, I doubt that if you do so, you will be my recurrent. So I did my first 3 months, and when I came back, my A1C was down to 6.7. After that, it was down to 6.4. Then I went to 6.2, and it went down slowly, gradually. And after about a year and a half, I go see her, and she told me, Mr. Lemieux, I'm an old doctor with old methods, so maybe this is another way of doing things. Maybe you should go public about this and help. Maybe it would help other diabetics. But then I look at her. You didn't believe me at first. Do you think that other people will believe me? So that's where my journey started, and since then I never looked back. Now after 1 year of doing low carb, only 1 year, my retinopathy reversed. So the scars from the past are still there, but there's no more bleeding in my eyes. My frozen shoulder went away. My trigger fingers are now perfect because they came back like 6 months after the surgery, and I lost 60 pounds in the process. So then my insulin dose went down from 120 units a day to around 40 units. So this is a game changer for me. So that's how low carb has been good to me. And in 2017, I ran another marathon, but this time I only required 25 grams of carbohydrate for the whole marathon. And I did my personal best. And at the end, I sprinted the last 2Ks of the marathon. So I still had energy to go even further. And 2 years after that, I did the ultra marathon. I ran 60 kilometers in 1 day, and I required only 40 grams of carbohydrates. So that convinced me that I don't need carbs to live.
That's
I
amazing.
still need small amounts of carbs, but I don't need 300 grams of carbohydrate a day. I do fine with eating between 30 and 50 grams of carbohydrate a day.
And you still do that now on a daily basis, and you're still able to keep your insulin doses down under 40.
Yeah, it's still under 40, and my most recent A1C is around 5.4, so it's like a non-diabetic. When I see my doctor now, he says that when he looks at my ambulatory graphic glucose profile, he says by looking at this, I wouldn't be able to tell that you're a type 1 diabetic. So
That's
and
incredible.
he encourages me to keep doing what I'm doing.
Yeah, so that's amazing. So but I think the thing is that I talked in the beginning about your type 1 community and how tight-knit they are. So there are a small number of type 1 diabetics who who follow the same therapy that you do, and obviously see amazing results, and so they do it, but they need to support each other, because generally their doctors won't support them in trying to do this. You were lucky, I think, in having your endocrinologist or whatever agree to at least let you try it, and agree to stand on the sidelines and maybe catch you if you fell, but was prepared to let you try it. Because if she wasn't, you might not have. You know, I mean, some people are convinced that that this is going to work for them after they study about it or whatever, and then their doctor won't support them, they'll fire their doctor. But it's often very then difficult to find another doctor that will help them. And I think that's one of the cool things about the Society of Metabolic Health Practitioners, that that's kind of evolved out of LowCarbUSA, was the fact that this is now a community of doctors that are open to this TCR concept, therapeutic carbohydrate reduction, and that now people can actually go in there to the provider list and try and find someone in their area that is prepared to help them. So as I mentioned at the beginning, that in our event coming up in Boca in January, we have this workshop specifically on type 1 diabetes, and then the entire first day of the conference on the Friday is all dedicated to talks on different aspects of this lifestyle and dietary intervention for type 1 diabetes. And we've had a subcommittee, including Belinda Lenours and Evelyn Baudoir, and even Tro Kalasian, who kind of started it in the beginning. And then basically, as you guys became established as this little subcommittee, he's stepped away from that. But you guys have done an enormous amount of work, and all of you have done a lot of work, but you especially have done an enormous amount of work. And I know you're very, very excited about how this is going to help the community. So maybe just talk about that. I know you almost brought me to tears a few weeks ago, talking about how much you felt like this was going to mean, what this was going to mean to your community. So maybe you can talk about that a little bit.
But I think I must start by saying that first, type 1 diabetes diagnostic is a tragedy. And over the years, I found out it doesn't have to be that way. But right now, we're 8.5 million type 1 diabetics around the world. And for every type 2 diabetic, type 1 diabetic living right now, we're missing a third one because they died of the complication of the disease. And I know it doesn't have to be that way. And when Evelyn reached out to me to be involved in this workshop and this event for the SMHP, I didn't hesitate 1 second, because I know how powerful it can be. But the problem is that many type 1 wants to try the low carb, and they do it by their own. They don't have any guidance. They don't have any support. And sometimes we think that just eating less carb will do the trick, and they don't know all the tips and tricks, like bolusing insulin for protein, how to dose insulin when you eat less carbs. So by having the knowledge, by having the experts sharing their tricks, their tips, it will favor success. And so that's why we decided to do this workshop. And since type 1 diabetes is such a complex disease, because we know there's at least 40 plus factors that affects the blood glucose in type 1 diabetics. And a type 1 diabetic has to take at least 180 decisions a day. So it's like we're having a parallel brain that's always thinking, is my blood glucose increasing? Is it reducing? Did I eat enough? Did I inject at the right time? So it's a very complicated. So by creating a workshop that will go around all the important topics for diabetics. It will empower type 1 diabetics to take better decision and work with their physician to take the right decision and have to take the proper steps, because there's a way to doing it, and it's all came from Dr. Bernstein with his law of small numbers. So if you take the most important factors that affect blood glucose, it's the food, the carbs, and the insulin. If you lower with a lot of small number, if I can resume it, it's small input makes small mistakes. So if you take small amounts of carbs and small amount of insulin, so you will have to do small corrections with glucose or small corrections with insulin, so you can keep the blood glucose stable. So by teaching all the topics that we will present in the clinical workshop will empower physicians to be able to help their patient, because there's a gap for physician, there's a gap for patients. So on both sides of the side of the doctors and the side of the patient, there's the information gap. But there were thousands and thousands of type 1 diabetics doing this right now, and it's working. It's working because it's based on logic. And I remember a quote from Einstein. It said that the insanity is doing the same thing over and over again and expecting the same results, a different result. So, and for me, I had to change something if I wanted to have a different result, and it's by doing low carb. So for this workshop, we reached out for those type 1 diabetic, these experts that can help with low carb, and many of them are type 1 diabetics that went back to school. Like we have Alison Urshidi, that she went back to school to become a registered dietitian. And we have Beth McNally, that is a type 1 mom that decided she wanted to be a nutritionist, and now she's doing a degree to be a registered dietitian. And we have Dr. Ian Lake, that when he read Dr. Bernstein's book the first time, he had to put it away for 1 year, because even for him, it was nonsense. He's a physician, and it was nonsense. But after a year, he took back the book and read it again, and now he has a program to help type 1 diabetics, and he has a program also to help physicians to learn more about how to manage type 1 diabetes with a keto low carb diet for type 1. So during this workshop, we will be able to present all those different topics, but it's basically nutrition, how to use medication safely, but also for women, like Alison Urshidi will present on hormonal issue for women. So it's more challenging for a type 1 diabetic woman to manage their blood glucose, because the hormones play a part in
A
theirs.
huge role in it, yeah.
Yeah.
Yeah, no, so I know you guys are really excited about it, and my sort of theme over the last few years in my events, or our events that we put on, has been that what starts here changes the world. And the other day I mentioned it to you, or mentioned it on this talk here, but the other day you said to me, Doug, we'd been like done a bunch of planning and stuff, and at the end of that you said to me, Doug, you know your thing about what starts here changes the world. You said, this is going to change the world for the type 1 diabetes community. And even now I'm choking up a little bit. That's just so amazing, because the whole point of starting LowCarbUSA, of doing this, was to try to help people that are struggling with different conditions to be able to overcome those by using these therapies. And when I realized how much this means to you and your community, it's exactly why we started this. So it's pretty cool. So just then quickly, and I can't even remember it. We created a code for you guys, for people that could then So the event is on the 12th. Well, it starts on the 11th with the workshop through to the 14th of January. And we've created a code for you guys to be able to get a 20% discount, and you can attend in person or the live stream. And both the in-person and the live stream attendees will get access to all the videos and stuff afterwards. If you can't attend during that time, you will still be able to watch it later. A 20% discount, no matter whether you sign up for the in-person or the live stream. And if you need it as a continuing education credit certificate, then that discount applies to that as well. But it's type 1 day, is it? What's the code?
It's type 1 BOCA in all capital letters.
Type 1 BOCA. Okay, I made it and I still didn't remember. So type 1 BOCA, all capitals, and make sure that you click apply so that and see that it adjusts your total owing before you hit submit. And yeah, let's get as many people exposed to this information as possible. I mean, that's the whole point of doing this, right? So hopefully this discount will help people to be able to access it.
We will also offer some documentation that will be on a Dropbox. So for every workshop, we'll have some documentation in the electronic format. So physician will be able to bring that back for their clinic.
So they've just got for reference, yeah.
For reference.
Yeah, and I mean, so this is another big difference here. Like we've last couple of times we've started this workshop thing the day before for people that came in early, not officially part of the conference. And so we've actually done it in a separate room while the AV guys were setting up during the Thursday to start the event on the Friday. But we've kind of, over the time of planning this thing, kind of become aware of the fact that this is going to be so important that we are actually going to stream the workshop over the live stream. So we're getting the AV guys to come in a whole day early to set up so that we can actually do the workshop in the main hall, and it'll be recorded and go out on the live stream. We'll have the videos available afterwards, and like you say, there'll be a Dropbox available to all the attendees as well, with all the materials that are presented during that workshop, which is going to be amazing.
People will be able to ask questions to the expert via the LowCarbUSA app. So if you have questions, write them down so you can ask the question. We will be talking about physical exercise. We will be talking about fasting for type 1 diabetics, hormonal issue in women, diet implementation, medication, and technology. So we try to cover most topics that are important for type 1 diabetics who want to try low carb with the assistance of their medical team.
Okay, and I think I forgot to mention in the beginning, but so it's on the LowCarbUSA website to go if you want to go and sign up for this. So you go to lowcarbusa.org. Okay, scroll down the page a bit and you'll see a big graphic or image to be able to click on to go to the BOCA event. Or under the menus, under events, you'll see the very first one in the drop down will be BOCA 2024. And you can get to go and register, remember the code to get your discount, and hopefully see a bunch of you. Either if you're able to attend it in person, it's just very difficult to even describe how much, well, how great it is to be there, the atmosphere and the ability to speak to people at dinner at night and during the wine tasting in the evening, and just being there is first prize. But we understand that a lot of people don't have the time, they can't get off, it's too far to travel or whatever. And so for those people, the live stream is going to be available to all of you as well. And I think so. Normally, what happens during the talks and that is on the live stream, Pam sits at the back with a chat going for the people that are on the live stream. I think what I'm going to do is get a couple of you on there as well, so that you can participate in that chat and answer people's questions, and you know, because then you can answer stuff that's specific to type 1 if people have those kinds of questions. So yeah, I'm super excited about this. I know that you are, and your whole community is. Thank you for putting in so much effort in planning this, because I think it's going to make it very special, and it's even shown me up a bit. It's made me realize how much more I can do it for the rest of our events in terms of planning it properly so that it runs smoothly. You've done an enormous amount of work, and you know, Evelyn is going to be up there, Troy is going to be up there, Belinda's going to speak at some point, but you're the unsung hero. You've been behind the scenes and you've done the most amount of work, and your contribution to this has been epic, and I thank you for that.
Just been inspired by a community. It all started in, I think it's 2015, when R.D. Dykman and Alison Urshidi started the Type 1 Grit Facebook group. And when you see the before and after, they helped so many people. So it's just a continuity. We have Lisa Lanassa, who has the Diverge Diabetes group. We have Beth McNally with Type 1D Nutrition. We have Bethany McKenzie, who started the Let Me Be 83 and the River Foundation. So it's all about the community holding together to change the world. So it's just a continuity. And we have Ian Lake that is spreading the news all over the world, and he created a program for physicians. I did this program, and it's amazing. More physicians need to know about this program because it will empower them to be supportive for their patient, and they won't fear the hypoglycemia in their patient because it will be doing the things the right way. So that's how the beautiful our low carb community is in the
type 1 low carb community. Yeah, they're very, very, very tight knit, close group. And so yeah, I'm just honored to be able to contribute, hopefully, to getting this out to more people, getting more people into your tight knit community so that they can all get help, because it's just incredible how different their lives can be if they just know how to manage it properly.
And I'm grateful to Dr. Evelyn Borzois because it started with an idea. When we were in Boca last year, we were launching out, and we should do a low carb event on the type 1 diabetes. So what we can say now that what starts in Boca changes the world, because from the Evelyn's idea, we're now doing a low carb session. So I'm very grateful to her.
Yeah, because, and I mean, you know, this whole concept of what starts here changes the world comes from a commencement speech that Admiral McRaven did at University of Texas. And as he's leading into his talk, one of the things that he says very emphatically is that one person can change the world by giving people hope. And I think that's what you guys are going to be able to do through this weekend in January. And I'm just privileged to be a part of it. It's awesome.
Thank you so much to you and Pam to accepting to doing this session on low carb. So
no, it was a no-brainer, man. It's just, and it was a no-brainer initially, but now that as we've been working with the subcommittee and talking about it more and more and more, I've become more and more aware of how important this is and how much it's going to mean to so many people. And yeah, like I said, no brainer. Thank you.
Thank you to you, Doug.
You've been listening to an episode of the Low Carb USA podcast. You can support us on Patreon at patreon.com/lowcarbusa.